so the scene is safe. I have the correct PPE, which is gloves and glasses. I'm going to explain the procedure to the patient and gain consent. So, hello, my name is Leah from New South Wales Ambulance. I'm just going to perform a neurological exam on you. Is that okay?
That's okay.
Okay, thank you. Okay, so then I'm going to make sure that the patient is positioned in comfort. Are you comfortable there?
Yep.
Okay. I'm then going to check the ABPU of the patient, so I'm going to check whether they're alert, whether they're responsive to verbal, if they're responsive to pain, or if they're unresponsive. So this patient is alert. From him talking to me, his airway's clear and I can see that he's breathing. He has an equal chest rise and fall. I'm then going to perform a fast exam. Okay, so I'm just going to checking his face. So what I want you to do is just give me a big smile. Excellent. So I'm just checking to make sure there is no facial drooping when he smiles, that it's equal. Thank you. You can stop smiling now. And then his arms. So I want you to close your eyes for me and just place your arms out straight. So I'm just checking to see whether one goes down than the other, but no, that's fine. Okay, thank you. And also as he's talking to me, I'm checking his speech, so any slurring or anything like that. And as well, I want to check the time, so whether he's had any of those symptoms and how long has he had them for. So then I'm going to determine any other causes of altered level of consciousness. So I will go through the A-E-I-O-U tips. So A being acidosis, E being epilepsy, I being insulin, O being overdose, U, uremia, T is trauma, I for infection, P for psychosis, and S for stroke. Once I've done that, I'll also check his blood glucose level. So as long as it's between 4 to 8 millimoles per litre, that's fine. So that's just a little prick on your finger, check a bit of blood. So
Okay.
Done that. I'm then going to determine his GCS scoring. So first would be his eyes. So that's based out of a point system of 4. So 4 being spontaneous, 3 being to voice, 2 being to pain, and 1 being that he's not opening his eyes at all. I'm then going to check voice. So that's a point system out of 5. So for eyes he would be 4. And for voice, 5 is oriented, 4 is confused, 3 is inappropriate, 2 is incoherent, and 1 is not verbal. So he's talking to me fine, so he is oriented. So he would be number 5 for voice. Motor, which is out of 6 points. So 6 being obeys, 5 localizes, 4 withdraws, 3 flexion, and 2 extension, and then 1 no movement. So he would be 6 in this case because he's obeying my commands and moving when I tell him to. I'm then also going to check his pupils with my pen light. Okay, so just look straight ahead for me. So I'm just going to flash this from the lateral to the median. Just making sure that his pupils are equal and reactive to light. I'd also note the pupil size and whether they're sluggish, that sort of thing. And I'd also note any stigmas, I think it's called, so any rapid eye movement as well. I'd also check any condition-specific tests. So there's Koenig sign, which can be like the neck to the chest, and also flexing his hip, the patient's hip. If a painful spasm of the hamstrings are felt, that is normally a sign of the Koenig's sign. There's also Romberg's sign, which I'd get the patient to stand up with their feet close together, with their eyes open to start with and noting any swaying, and then when they close their eyes, if they start to sway, it's a positive for Romberg's sign. And then also you could check the 12 different cranial nerves. So for the smell one, you could use a alcohol swab by just placing it under their nose to check the back cranial nerve. But yeah, and then I'd explain any findings to the patient, and that's all good.